So this is Siddhant Pradhan, who is a dentist. So Siddhant, can you give us a brief of your career so far?
So I've been practicing for a year. It takes a long time to become a dentist. So 5 years undergrad, 3 years of postgrad. But I've only been practicing for a year. Basically because I've specialized, I'm doing mostly oral surgical work and not too much general dentistry.
All right, great. So what skills does it take to pursue being a dentist?
Um, in terms of skill, you have to have three things. I think one of the most important things is you have to be very highly motivated because it takes a really, really long amount of time to finish actually studying. Two, it does require some hand-eye coordination and a sense of touch. That's one of the most important things. You have to be soft with your patients. It's not much of a requirement, and you can learn it over time. But some people just intuitively have it. But again, as I said, the more you work on that, the better you will be with patients. Um, so motivation, you have to be highly motivated. You have to be very diligent in your work and sort of read, constantly be reading, looking for new information, things like that. And the other really important skill that you have to have as a dentist is you have to be able to empathize with the patient. I think that's a very important thing because unlike actually with a doctor, sometimes if you're operating on them, the patient's under anesthesia, they're not awake. With dentistry, they're awake at all times. They can feel everything that you're doing. So it's very important to empathize with the patient. Those are things that you really, really need to have.
All right. So what guidance do you have for some students who are looking to pursue this type of career?
So again, the first thing that I would say is you have to be absolutely sure, because any medical career, there are no shortcuts. It takes a long time to become a doctor or a dentist. Um, you need to be sure from the beginning that this is what you want to do, right? You can, of course, change your mind later on, but once you're down that road, I think you have to be absolutely certain that you want to do it. So that's one thing that you need to be absolutely certain that you want to do it. The second thing, work hard. I think that's one of the most important things that anybody will tell you, but that's especially true in a medical situation because I'm 29 years old and I'm still studying. It never ends. There's no end to this. There's new things that will come throughout all the time. And with the whole COVID pandemic, it's basically turned our profession upside down. So everybody's going to have to relearn things. So the studying never stops. So work really hard, improve your skills as much as you can, and you have to be sure that you want to do it. That's the most important thing.
Wow, that sounds great. Okay, so why don't you tell me the impact of technology on being a dentist, on dentistry?
Technology has completely changed dentistry in probably the best way possible. Um, I'm going to use just two or three examples. Number one is what we call a CBCT, which is a CT scanner for dental uses, essentially. And it's only used for the head and neck area. It's only used for dental work. That's completely changed the way you look at, um, for example, extracting wisdom teeth, which can be difficult at times due to certain anatomic demands, um, as well as placing dental implants. I think those are the two things that have been changed completely by the CBCT machine. The other thing that's changed dentistry completely is the advent of 3D printing. In the old days, when people would have to get caps or something, they would be sort of handmade by a technician. The precision would be lacking in certain places. You'd have to take an impression, make a model of it. So those are all processes that in maybe a year or two could cease to exist. We in what I do, you can honestly avoid taking an impression. You just get a digital model made. You can get the planning can all be done on a computer, and there's absolutely no need to have to get something handmade anymore. It's all done by machines. It's all done by 3D printers.
All right. So thank you, Siddhant. Thank you so much for your time and good luck on your dental work.
Most welcome.